welcome to another deep dive. If you're here, you must be at least a little bit curious about how things work.
Oh, yeah.
And today, well, we're really diving deep into something that affects every single one of us.
Absolutely.
Pharmacology.
Yeah.
We're going to be looking at pharmacology demystified.
Okay.
It's kind of like taking a crash course, but,
Yeah.
way more fun.
Yeah.
Our goal today is to give you the knowledge so you can understand how these drugs work and their effects, and also the crucial role that nurses play in the medication administration.
So it's a huge field.
It is.
And it's really fascinating when you think about it, how it has evolved from, you know, folklore and herbal concoctions.
Yeah, you think about how long people have been
Oh, yeah.
trying to use things to heal themselves.
Exactly. And what's interesting is even with those ancient remedies, you can see the principles of pharmacology.
Oh, for sure.
That idea that certain substances can interact with the body to produce an effect.
It's like our ancestors were like the original biohackers.
Yep.
They were just experimenting with nature to see how they could heal themselves or change their bodies.
Yeah.
But how did we go from those early experiments to the really precise applications we have today?
Well, the evolution of pharmacology is really about increasing precision and control.
Yeah.
So the apothecary system was a huge step forward.
Okay.
I mean, can you imagine if you're trying to measure out ingredients, but there's no standardized unit?
Oh, it would be chaos.
It would be chaos. So the apothecary system gave us a way to quantify drugs and ensure some consistency,
Okay.
which really paved the way for modern pharmaceutical practices.
It is amazing to think about how much we take for granted.
Oh, for sure.
That, I can take a pill and know that it has in it what it says it has.
Absolutely.
But even with that precision, I've always wondered, how does a drug know where to go in the body and what to do?
Okay, so that's a really good question. And that's where we get into pharmacokinetics.
Okay.
And it's really like a complex journey that a drug takes through the body. So think about when you swallow a pill, first it has to break down,
Okay.
be absorbed into your bloodstream.
Right.
Then it gets distributed throughout your body, carried by the blood to different organs and tissues.
Okay.
But here's the catch. Some drugs encounter a roadblock called the first pass effect.
The first pass effect.
Yes.
Okay. What is that?
So imagine like a toll booth on a highway.
Oh.
As a drug travels through the bloodstream, it passes through the liver, and the liver acts like that toll booth.
Oh.
Some drugs get metabolized or broken down by the liver before they can reach their target destination.
It's like they're paying a toll to get
Exactly
what
where they need to go.
And that reduces the amount of drug that can actually do its job.
Okay, that is a great analogy. I love that.
Thanks.
So that makes you think about, taking a pill is only the beginning.
Exactly.
But let's say a drug does, navigate that toll booth, successfully gets to where it needs to go.
Right.
How does it actually work at a cellular level?
Okay. So that is where we get into pharmacodynamics.
Yeah, and this is the study of what drugs do to your body.
Okay.
So many drugs work by interacting with specific targets on cells called receptors.
Okay.
And these receptors are like locks, and the drugs are like keys that fit into them.
So it's all about finding the right key for the right lock.
Exactly.
Right.
So some drugs act as agonists, which means they activate those receptors,
Okay.
triggering a specific response in the cell.
So it's like turning on a function in the cell.
Yeah, exactly. Like think about decongestants.
Okay.
They act as agonists. They activate receptors that constrict blood vessels in your nasal passages, which reduces swelling and allows you to breathe easier.
So it's like flipping a switch to turn on a specific function.
Exactly.
But not all drugs are about, activating things.
Right.
Some drugs act as antagonists,
Yes.
which means they block those receptors.
Yes, they prevent other substances from binding and triggering a response.
So it's like putting a stop sign in front of a cellular process.
Yeah, exactly. So beta blockers, for example, are antagonists.
Okay.
They block certain receptors in heart cells, which slows down your heart rate and lowers your blood pressure.
That is so cool. It's like this delicate dance of activation and inhibition
Exactly.
that's happening at a microscopic level.
And that dance is happening all the time throughout your body,
Oh.
influencing everything from how you breathe to how you feel.
That is amazing.
Mm.
It really makes you appreciate how complex our bodies are
It is.
and how powerful those tiny drug molecules are.
Absolutely.
But with that power comes responsibility.
Yes.
We need to make sure that these drugs are safe and effective.
Absolutely. And that's where the FDA comes in
Okay.
with its rigorous drug approval process.
Yeah, because before a drug hits the market, it goes through years of testing.
It does.
starting with animal studies and then human clinical trials.
It's a long process.
Those clinical trials sound pretty intense.
They are.
How do they actually determine if a drug is safe and effective?
Okay, so one of the key concepts is the therapeutic index.
The therapeutic index.
Yes, and it's like a balancing act between a drug's desired effects and its potential toxicity.
So finding that sweet spot where the benefits outweigh the risks.
Exactly.
Got it.
So drugs with a narrow therapeutic index like digoxin, which is used to treat heart failure, require careful monitoring because even a small change in dosage
Oh, wow.
could tip the scale toward dangerous side effects.
That makes sense.
Yeah.
So we have these safeguards in place to make sure that the drugs are safe,
Right.
but it's also important to have experts in medication administration.
Absolutely.
And that's where nurses come in.
Yes, nurses are on the front lines of patient care.
Right.
They play a critical role in making sure that the medications are given safely and effectively.
Yeah, they are like the guardians of medication safety.
They are. They're like medication detectives. They gather information about the patient's medical history,
Okay.
allergies, and current medications to identify any potential red flags.
So they're not just administering the medication, they're really looking at the whole picture to make sure that it's safe for the patient.
Yes, and they're looking out for potential problems related to medication,
Okay.
like adverse drug reactions or drug interactions.
Wow. It's a huge responsibility.
It is.
It sounds like it. And it's not just about, following a doctor's orders.
Right.
They're really using their knowledge.
Absolutely. They're constantly assessing the patient's response to medication, looking for the good effects and also for potential side effects.
Yeah.
And educating patients about their medications,
Yeah.
answering their questions, addressing concerns.
That is amazing.
Yeah.
So it really is like they are those guardians of medication safety,
Absolutely.
making sure patients have the best outcome.
Yes.
And speaking of outcomes, did you know that a drug's journey doesn't end when it reaches its target?
Right.
There's this whole concept of a drug's half-life.
The half-life, yes, that's a really good point.
Okay, so what is that?
So it's like a ticking clock for a drug molecule.
Okay.
It tells us how long it takes for half of the drug to be eliminated from the body.
Oh, so it's not like it just instantly disappears.
No, not at all.
It lingers for a while.
It does, and that half-life determines how often you need to take a medication to maintain its effectiveness.
Well, wow.
So some drugs have short half-lives, meaning you might need to take them multiple times a day.
Right.
Others have longer half-lives. You can take them once a day.
So even the timing of medication is influenced by
Absolutely.
these pharmacokinetic principles.
It is.
That is so cool. It makes you realize how much goes into
It does.
designing and prescribing medications effectively.
It is a fascinating field, and honestly, we've only just scratched the surface.
I know, and I already feel so much more informed about how drugs work.
Good.
But I think it's time to get a little bit more specific
Okay.
and delve into some examples of drug classes and how they interact with different systems in the body. What do you say?
Let's do it.
Okay.
I agree. Let's get specific. Understanding how different drug classes work is key to really getting pharmacology.
Okay, so where do we start? Maybe with the system that affects us all.
Oh, okay.
The nervous system.
Oh, yeah.
It controls everything from, our thoughts and emotions.
Right.
Our movements and sensations.
The nervous system is a great place to start because it's a prime target for so many medications.
That makes sense.
You think about it, drugs that affect the brain can alter mood, relieve pain, even treat seizures.
Okay, so what are some of the key drug classes that act on the nervous system?
Well, there are anxiolytics and hypnotics,
Okay.
which are used to reduce anxiety and promote sleep.
Okay.
These medications often work by enhancing the effects of a neurotransmitter called GABA,
GABA.
which has these calming effects on the brain.
It's like the brain's chill pill.
Exactly, by boosting GABA's activity.
Right.
These drugs help to ease anxiety and promote relaxation.
Makes sense. And then there are antidepressants.
Yes, antidepressants are used to treat depression and other mood disorders.
Right.
These medications work in a variety of ways, but they often target neurotransmitters like serotonin, norepinephrine, and dopamine, which are involved in regulating mood motivation and reward.
It's fascinating how these medications can literally change the chemical landscape of the brain
Yeah,
to help restore balance and improve mood.
it really is.
And then there are antipsychotics.
Antipsychotics are used to treat psychotic disorders like schizophrenia.
Okay.
These medications often work by blocking dopamine receptors in the brain,
Okay.
which helps reduce things like hallucinations, delusions, and other symptoms.
So they're kind of like putting a filter
Exactly.
on those distorted thoughts.
That's a good way to put it.
And then there are anticonvulsants.
Yes, anticonvulsants are used to treat seizures.
Okay.
These medications work in a lot of different ways, but they often aim to stabilize electrical activity in the brain,
Oh, wow.
preventing those abnormal bursts of activity that can lead to seizures.
So it's like they're literally calming the electrical storms in the brain.
Exactly. And it's a testament to how much we've learned about the brain
Wow.
and its intricate workings.
And then there are analgesics.
Ah, analgesics medications used to relieve pain.
Right, because pain relief is something we can all relate to,
Oh, for sure.
whether it's, a headache or a muscle ache or something more serious.
Absolutely. And analgesics come in a variety of forms,
Okay.
from over-the-counter pain relievers like ibuprofen to really powerful opioids like morphine.
So how do analgesics actually work to stop those pain signals?
Okay, so they work in different ways depending on the specific type of analgesic.
Okay.
So some, like NSAIDs, reduce inflammation and pain by blocking the production of certain chemicals in the body called prostaglandins.
Okay.
Others, like opioids, work by binding to opioid receptors in the brain and spinal cord, blocking those pain signals.
So they're stopping the pain signals at the source, or they're intercepting them
Exactly.
before they get to the brain.
You got it.
Wow. And then there are anesthetics?
Anesthetic.
Those are the medications that cause a loss of sensation?
Yes, either locally or throughout the whole body.
Right.
And these medications are used for all sorts of things, from numbing a small area for a procedure to inducing general anesthesia for surgery.
Anesthesia is one of those medical marvels that just amazes me.
Me too.
It's incredible that we can temporarily switch off consciousness and sensation.
It is, and it's all made possible because of our understanding of how these medications interact with the nervous system.
Wow. Okay. So we've covered some of the key drug classes that act on the nervous system.
Right.
But what about other systems in the body?
Okay.
Like the endocrine system, which controls our hormones.
Okay, the endocrine system. That's another fascinating area of pharmacology.
Yeah.
So hormones are chemical messengers
Right.
that regulate a wide range of bodily functions,
Right.
everything from growth and development to metabolism and reproduction.
So when things go wrong with the endocrine system, it can really have like a domino effect
Upset.
throughout the body.
Big time.
That's where medications come in.
Exactly. And there are a variety of drugs that can either replace missing hormones, block the production of excess hormones, or even mimic the effects of hormones.
Okay, so let's get specific. What are some common examples of endocrine medications?
Well, one of the most well-known is insulin, which
What?
is used to treat diabetes.
Right.
So insulin is a hormone that helps regulate blood sugar levels.
Right.
And people with diabetes either don't produce enough insulin or their bodies don't use it effectively.
So the insulin injections are essentially replacing
Exactly.
that missing hormone.
Yeah, helping to keep those blood sugar levels in check.
And then there are thyroid medications.
Yes. Thyroid medications are used to treat hypothyroidism,
Okay.
which is a condition where the thyroid gland doesn't produce enough thyroid hormone.
Right, and thyroid hormone is crucial for regulating metabolism.
It is.
So a deficiency can lead to fatigue, weight gain, other symptoms,
Exactly.
and then there are corticosteroids.
Corticosteroids are powerful anti-inflammatory medications
Okay.
that mimic the effects of hormones produced by the adrenal glands.
And corticosteroids are often used to treat conditions like asthma, allergies, autoimmune disorders.
Exactly. They can be very effective, but they can also come with some potential side effects.
Right, so it's important to really weigh the risks and benefits carefully.
Absolutely.
And then there are medications that target the reproductive system,
Yes.
like hormonal contraceptives.
Hormonal contraceptives have really revolutionized family planning,
Yeah,
giving women more control over their reproductive health.
absolutely.
So they work by manipulating the levels of hormones like estrogen and progesterone, preventing ovulation and making it more difficult for sperm to fertilize an egg.
It's amazing how we can use our understanding of hormones to create medications that have such profound effects
It is.
on our body.
It really is. And the endocrine system is just one example of how pharmacology can be used to treat a wide range of conditions.
It's like we're constantly unlocking new secrets about the body
We are.
and finding new ways to manipulate its systems
It is.
for therapeutic benefit.
It's a fascinating field that's constantly evolving.
I agree, but I think it's time to shift gears a bit and talk about a system that's often overlooked,
Right.
the immune system.
Oh, the immune
Our
system.
body's first line of defense against infection and disease.
It's truly remarkable, a complex network of cells and organs working together to protect us from invaders.
And when things go wrong with the immune system,
Yeah,
it can leave us vulnerable to a whole host of illnesses.
it does. And that's where medications that target the immune system come into play.
Okay, so let's break down some of the key drug classes that act on the immune system.
All right.
What's the first one that comes to mind?
Vaccines.
Vaccines.
They are a classic example of how we can harness the power of the immune system to prevent disease.
Vaccines are like a training program for our immune system,
Totally.
exposing it to, a weakened or inactive form of a pathogen so it can learn to recognize and fight it off in the future.
Exactly. It's like giving our immune system a sneak peek at the enemy,
I love that.
so it's ready for battle.
That is a great way to put it. And then there are immunosuppressants.
Immunosuppressants.
Those are used to suppress the immune system.
Right, in certain situations.
Right.
Often to prevent organ rejection after a transplant.
That makes sense. Otherwise, the body might see that transplanted organ as a foreign invader and attack it.
Exactly. It's a delicate balancing act.
It is.
Suppressing the immune system just enough to prevent rejection, but not leaving the patient vulnerable to infection.
It's incredible how those medications can literally tamp down that immune response.
Yeah.
To allow for those life-saving transplants.
It is a testament to the power of pharmacology to manipulate even the most complex systems in the body.
Okay, so we talked about vaccines, immunosuppressants. What about other medications that target the immune system?
Well, there are also antihistamines
Oh, yeah.
used to treat allergies.
Allergies.
Yeah.
Those annoying reactions to things like pollen dust mites and pet dander.
Exactly. And allergies are basically an overreaction of the immune system to a harmless substance.
Right.
So antihistamines work by blocking the effects of histamine, a chemical released by the body during an allergic reaction,
Okay.
which causes those symptoms like sneezing, itching, runny nose.
So it's like they're putting a stop to that histamine cascade
Exactly.
before it can really get going.
We've got it.
And then there are medications that target very specific immune cells or pathways,
Right.
like monoclonal antibodies.
Monoclonal antibodies are like guided missiles
They are.
that target specific proteins involved in the immune response.
And they're being used to treat a wide range of conditions, from cancer to autoimmune disorders.
It's a rapidly evolving area of pharmacology,
It is.
and we're only just beginning to tap into its potential.
That's so exciting to think about what the future holds
It is.
for these immune-based therapies.
Absolutely.
Okay, but I think it's time to move on to another vital system,
Okay.
the cardiovascular system,
All right.
which is responsible for circulating blood throughout the body.
The cardiovascular system, the engine that keeps us running. And when things go wrong with the cardiovascular system, it can have serious consequences.
Right. I'm thinking heart attacks, strokes, high blood pressure, all those things.
All those things.
Scary.
Exactly. And that's why there's a whole arsenal of medications designed to target the cardiovascular system.
Okay, so let's dive into some of those key drug classes.
Okay.
What's the first one that comes to mind?
Antihypertensives.
Antihypertensives.
These are medications that are used to lower blood pressure.
Right. High blood pressure or hypertension is a major risk factor
Sure.
for heart attacks, strokes,
Yeah.
and other cardiovascular problems.
Exactly. And there are a variety of antihypertensives, each working in slightly different ways.
So let's break down those different mechanisms of action.
All right. So there are diuretics,
Okay.
which help the kidneys eliminate excess salt and water, reducing blood volume and lowering blood pressure.
So it's like taking the pressure off by literally reducing the amount of fluid
Exactly.
that's circulating through those blood vessels.
You got it.
And then there are beta blockers.
Beta blockers, they slow the heart rate
Okay.
and reduce the force of heart contractions, lowering blood pressure.
So it's like calming things down a bit,
Exactly. Giving the heart a break.
giving the heart a break.
Yeah.
And then there are ACE inhibitors.
ACE inhibitors block the production of a hormone that constricts blood vessels,
Okay.
allowing them to relax and widen, which reduces blood pressure.
So it's like they're working on the plumbing,
Exactly.
so to speak, making those blood vessels more accommodating.
You got it. And then there are calcium channel blockers,
Okay.
which also relax the muscles in the walls of the arteries, allowing them to widen and reducing blood pressure.
So it's like a multi-pronged approach using different medications to target different aspects of blood pressure regulation.
Exactly.
Makes sense. And then another important class of cardiovascular medications are antiarrhythmics,
Antiarrhythmics.
which are used to treat irregular heartbeats.
Yes. Or arrhythmias.
Arrhythmias can be dangerous because they can disrupt the heart's normal rhythm,
Right.
leading to inefficient pumping of blood.
Exactly. And antiarrhythmics work in a variety of ways,
Okay.
but they often aim to stabilize the heart's electrical activity,
Okay.
restoring that normal rhythm.
It's amazing how these medications can fine-tune the heart's electrical system
It
just
is.
keeping it beating in sync.
It is a testament to our growing understanding of the heart and its intricate workings.
Okay, so we've covered antihypertensives, antiarrhythmics.
Right.
What about medications that target blood clots?
Ah, blood clots.
Because those can be incredibly dangerous,
They can.
leading to heart attacks and strokes and other serious problems.
You're absolutely right. And that's where we get into anticoagulants and antiplatelets.
Okay, so let's break down those two categories.
Okay, so anticoagulants like heparin and warfarin,
Okay.
they work by interfering with the clotting cascade,
Okay.
which is that complex series of steps that leads to clot formation.
So they're essentially disrupting the process.
Exactly.
That leads to those dangerous clots.
Exactly.
And then there are antiplatelets.
Yes, antiplatelets like aspirin and clopidogrel,
Okay.
they work by preventing platelets from sticking together and forming clots.
So they're targeting the building blocks of clots, preventing them from forming in the first place.
You got it.
Okay, and then sometimes, if those blood clots do form, we need to bring in the big guns, thrombolytics.
Ah, thrombolytics. Those are the clot-busting medications
Yeah.
used in emergency situations.
Right, like heart attack and stroke.
Exactly. They work by dissolving those existing blood clots, restoring blood flow to vital organs.
That is incredible.
That can be life-saving.
It really is a medical miracle.
It is.
Okay, so we've covered medications that lower blood pressure, regulate heart rhythm,
Right.
prevent or dissolve blood clots.
Yes.
What about medications that target cholesterol and other lipids?
Ah, lipids. So these are the fats that circulate in our bloodstream.
Right.
And high levels of certain types of lipids, like cholesterol, can contribute to the buildup of plaque in our arteries,
Okay.
which is a condition called atherosclerosis.
Right, it's like clogging the pipes
Exactly.
of our cardiovascular system.
Yeah, increasing the risk of heart attacks and strokes.
Exactly, and that's where antilipemics come in.
Antilipemics. Yes.
These are medications that lower abnormal blood lipid levels.
Yes. They're like cholesterol busters.
They are.
They work in a few different ways,
Okay.
but the goal is to reduce the amount of those harmful lipids in the bloodstream,
Okay.
reducing the risk of those cardiovascular events.
Amazing. Okay, so we've covered a lot of ground here.
We have.
From medications that act on the nervous system to those that target the cardiovascular system.
Right.
But I think it's time to move on to another crucial system,
Okay.
the respiratory system,
Right.
which is responsible for our breathing.
The respiratory system, essential for life.
It is.
Yeah.
And when things go wrong with the respiratory system,
Yeah.
it can be incredibly frightening.
It can, I'm thinking asthma, COPD, pneumonia, all those conditions,
Yeah.
that can make it so difficult to breathe.
Exactly.
And there's a whole category of medications designed to target the respiratory system.
So let's dive into some of those key drug classes.
Let's do it.
What's the first one that comes to mind?
Bronchodilators.
Bronchodilators.
These are medications that relax the muscles in the airways, opening them up, making it easier to breathe.
Right. They're often used to treat conditions like asthma and COPD.
Exactly.
And asthma is a chronic condition that causes inflammation and narrowing of the airways,
It does.
making it difficult to breathe.
It does. And bronchodilators help relieve those symptoms by opening up those airways, allowing air to flow more freely.
It's like taking a deep breath after being underwater for too long.
That's a great analogy.
And then there are inhaled corticosteroids,
Inhaled corticosteroids.
which are often used in combination with bronchodilators
Yes.
to reduce inflammation in the airways.
Exactly.
Right.
So corticosteroids are these powerful anti-inflammatory medications,
Right.
and when they're inhaled, they target the inflammation in the lungs directly.
And then there are mucolytics,
Eucalypt.
which thin the mucus in the airways.
Yes, making it easier to cough up.
Right. So mucolytics are often used to treat conditions like bronchitis and cystic fibrosis,
They are.
where that thick mucus can really clog the airways, making it hard to breathe.
Exactly.
And then there are antibiotics,
Antibiotics.
which are used to treat bacterial infections of the respiratory system.
Yes, like pneumonia.
Right. Pneumonia is a serious infection of the lungs that can be life-threatening.
It can be.
And antibiotics work by killing the bacteria
Right.
that are causing the infection.
Exactly.
So it's like they're going in and targeting those tiny invaders
Yes.
to clear up the infection.
They are. It's amazing how these medications can do that.
It's a testament to the power of pharmacology.
It is.
Okay, so we've covered medications that open up the airways, reduce inflammation, thin mucus,
Right.
fight off infections.
Yeah.
What about medications that target the oxygen carrying capacity of the blood?
Okay, so you're thinking about medications that increase red blood cell production? Like erythropoietin.
Erythropoietin.
So that's a hormone that stimulates the bone marrow to produce more red blood cells.
Right, and it's often used to treat anemia. A condition where there's a deficiency of red blood cells,
Yeah.
which carry oxygen throughout the body.
Exactly. And anemia can lead to fatigue, shortness of breath, other symptoms.
Right.
And by increasing red blood cell production, erythropoietin can help to alleviate those symptoms and improve the body's oxygen carrying capacity.
It's like giving the body a boost of energy
Yes.
at the cellular level.
That's a great way to think about it.
Okay, so we've covered a lot of ground here,
We have.
from medications that act on the nervous system
Right.
to those that target the respiratory system.
Absolutely.
But I think it's time to move on to another important system,
Okay.
the gastrointestinal system.
Okay, the gastrointestinal system, the engine that powers our bodies.
It is.
And when things go wrong in the GI tract,
Yes.
it can really impact our overall health.
Okay.
I'm thinking nausea, vomiting, diarrhea, constipation, all of those fun digestive issues.
All those fun things, yeah.
And there are specific medications that target each of those issues.
Okay, so let's start with nausea and vomiting.
Okay.
What causes those lovely symptoms?
Well, it can be triggered by all sorts of things.
Mm.
Motion sickness, infections, medications, even pregnancy.
Morning sickness, a rite of passage
Exactly.
for many expectant mothers.
Exactly. But regardless of the cause, nausea and vomiting can be so debilitating.
It can be.
So antiemetics work to provide relief by targeting different parts of the brain and nervous system that control that vomiting reflex.
Okay.
Some block dopamine receptors, others work on serotonin receptors,
Wow.
and some even affect histamine receptors.
So it's like a multifaceted approach depending on the type of antiemetic.
Exactly.
And speaking of digestive discomforts, let's talk about diarrhea.
Oh, yeah.
Not the most glamorous topic,
Not at all.
but something we've all experienced
At some point.
at some point.
Those frequent, loose, and often urgent bowel movements. It's not fun.
Not fun. And they can also lead to dehydration, which is a serious concern.
It is.
So how do antidiarrheals work to slow things down?
Okay, so they work in a couple different ways.
Okay.
So some like loperamide work by slowing down intestinal motility,
Okay.
which basically means they reduce those muscle contractions that move food through the digestive tract.
So like putting on the brakes a bit.
Exactly.
Right.
And then there are absorbent antidiarrheals like bismuth subsalicylate,
Okay.
which work by absorbing excess fluid in the intestines.
So they're helping to solidify things.
Exactly.
Right.
And on the opposite end of the spectrum, we have constipation,
Right.
characterized by infrequent, hard, and difficult to pass bowel movements.
Definitely not something you want to talk about at the dinner table,
Not really.
but a very common problem,
Especially as we age.
especially as we age. And there are a few different types of laxatives that can help get things moving again.
There are.
So let's break down those laxative options.
Okay, so we've got bulk-forming laxatives, which basically add fiber to the stool, making it easier to pass.
Okay.
And then there are osmotic laxatives,
Okay.
which draw water into the colon, softening the stool.
Okay.
And finally, we have stimulant laxatives,
Okay.
which stimulate intestinal contractions to move things along.
So it's all about finding the right type of laxative
It is.
for the individual's needs
Exactly.
in their situation.
It is.
And another common GI issue that we haven't touched on is GER,
GER.
gastroesophageal reflux disease.
Yeah, that burning sensation in the chest and throat.
Ugh,
That can ruin a good meal.
you can.
It's caused by stomach acid backing up into the esophagus, irritating the lining.
Not pleasant.
No.
So how do medications help to tame that fiery beast?
Okay, so there are a few different approaches.
Okay.
One is to neutralize the stomach acid with antacids.
Okay.
Then there are H2 blockers,
Okay.
which reduce the production of stomach acid.
Okay.
And finally, we have proton pump inhibitors, or PPIs, which block the enzyme responsible for pumping acid into the stomach.
So they're like the ultimate acid blockers.
They are.
Okay, so
Yeah.
we've covered medications that target nausea and vomiting,
Right.
diarrhea, constipation, GERD.
Yes.
What about medications that target ulcers?
Ulcers, those are sores that develop in the lining of the stomach or duodenum,
Okay.
the first part of the small intestine.
Right, and they can be incredibly painful and even lead to serious complications
They can.
if left untreated.
If left untreated, absolutely.
And the most common cause of ulcers is a bacterial infection
It is.
called Helicobacter pylori, or H. pylori.
Exactly.
So the treatment often involves a combination of medications
It does.
to kill the bacteria
Yeah,
and reduce stomach acid production.
exactly. And another really important aspect of gastrointestinal health is the gut microbiome.
The gut microbiome.
Yeah, it's that collection of trillions of bacteria that live in our intestines.
It's like an internal ecosystem that plays such a crucial role in our overall health.
It really does. And imbalances in the gut microbiome have been linked to a wide range of health problems,
Wow.
from digestive disorders to autoimmune diseases.
So how can we manipulate the gut microbiome for therapeutic benefit?
Well, one approach is through the use of probiotics.
Probiotics.
Yeah, those live microorganisms that, when administered in adequate amounts, can actually confer health benefit on the host.
Right. Probiotics are often marketed as supplements that can improve digestion and boost the immune system.
They are
And then there are prebiotics,
prebiotics.
which are non-digestible food ingredients that promote the growth of those beneficial bacteria in the gut.
Exactly. They're like fertilizer for the good bacteria in our gut.
Okay, so we've covered a lot of ground here, from medications that act on the nervous system
Right.
to those that target the gastrointestinal system.
We have.
I think it's time to move on to another fascinating area of pharmacology:
Okay.
medications that target the kidneys and urinary tract.
Okay, the kidneys, the body's filtration system,
There.
removing waste products from the blood and regulating fluid balance.
And when things go wrong with the kidneys,
Yes.
it can have a ripple effect
It can.
throughout the body.
Absolutely, and that's why there's a whole category of medications
Right.
designed to target the kidneys and urinary tract.
So let's dive into some of those key drug classes.
Okay.
What's the first one that comes to mind?
Diuretics.
Diuretics.
We talked about them in the context of high blood pressure,
We did.
but they're also used to treat a variety of other conditions, including edema or fluid retention.
Right. And edema can occur for a variety of reasons, from heart failure to kidney disease.
It can.
And diuretics help reduce that edema
They do.
by increasing urine output, removing that excess fluid from the body.
Yeah, it's like flushing out the system.
Exactly. And then there are medications that treat UTIs,
UTIs, urinary tract infections.
urinary tract infections, which are incredibly common,
They are, especially in women.
especially in women.
Yeah, and they're caused by bacteria that enter the urethra, the tube that carries urine from the bladder to the outside of the body.
And the treatment typically involves antibiotics to kill the bacteria.
Exactly.
And then there are medications that target kidney stones.
Kidney stones.
Those are hard deposits that form in the kidneys,
They are.
and they can cause excruciating pain
They
when
can.
they're passing through the urinary tract.
They are often treated with pain relievers and medications that help to relax the muscles in the urinary tract,
Okay.
making it easier for those stones to pass.
It's incredible how those medications can target such specific problems
It is.
in the kidneys and urinary tract.
It is a testament to the power of pharmacology to address a wide range of health concerns.
Okay, so we've covered medications that target the nervous system, the cardiovascular system, the respiratory system,
Right.
the gastrointestinal system, and the kidneys and urinary tract.
Yes.
But I think it's time to move on to another important area of pharmacology:
Yep.
medications that target the musculoskeletal system,
The musculoskeletal system.
which includes our bones, muscles, and joints.
It's what allows us to move and interact with the world around us.
It is. And when things go wrong with the musculoskeletal system, it can be incredibly debilitating.
It can be.
You're thinking about things like arthritis, osteoporosis, muscle spasms, all those conditions that can limit our mobility
Yes,
and cause pain.
absolutely. And that's why there's a whole category of medications
Right.
designed to target the musculoskeletal system.
So let's dive into some of those key drug classes.
Okay.
What's the first one that comes to mind?
NSAIDs, non-steroidal anti-inflammatory drugs.
NSAIDs.
We talked about them already in the context of pain relief,
We did.
but they're also commonly used to treat inflammation in the musculoskeletal system.
Right, like arthritis.
Exactly.
A classic example.
Yeah, it's a condition that causes inflammation and pain in the joints.
Right.
And NSAIDs can help to reduce that inflammation and pain, improving mobility and quality of life.
So it's like putting out the fire in
Exactly.
those inflamed joints.
You got it.
And then there are corticosteroids,
Corticosteroids.
which are more powerful anti-inflammatory medications
Yes.
that can be used to treat more severe cases of arthritis or other inflammatory condition.
Exactly. And they can be given orally injected directly into the joint or even applied topically to the skin.
Wow. And then there are medications that target osteoporosis,
Osteoporosis.
which is a condition that weakens the bones
It does.
and increases the risk of fractures.
Exactly. And osteoporosis is often called a silent disease
Yeah.
because it can progress without symptoms until a fracture occurs.
So it's important to get screened
You
for
know?
osteoporosis, especially as we age.
Absolutely.
So what are some of the medications that are used to treat osteoporosis?
Okay, so there are bisphosphonates,
Okay.
which work by slowing down the rate at which bone is broken down.
Okay.
And then there are medications that actually stimulate bone formation.
Okay.
like
So it's
teriparatide.
like a two-pronged approach,
It is.
slowing down the bone loss and then
Yeah.
promoting new bone growth.
Ex-
And then there are medications that target muscle spasms,
Yes.
like muscle relax.
Muscle relaxant.
And muscle spasms can be caused by a variety of things, from injuries to neurological conditions.
A lot of things.
And muscle relaxants work by reducing muscle tension
Right.
and spasms.
Yeah. Relieving pain and improving mobility.
It's like loosening those tight muscles,
Exactly.
giving them a chance to relax.
You got it.
Okay, so we've covered medications that target inflammation, osteoporosis, and muscle spasms. What about medications that target gout?
Gout.
Gout.
That's a type of arthritis that's caused by a buildup of uric acid in the joints.
Right, and it's known for causing those sudden, intense attacks of pain, swelling, and redness.
It is. It is. And the medications used to treat gout work in a few different ways. Some, like colchicine, reduce inflammation. Others, like allopurinol, lower uric acid levels in the blood.
So it's like a two-pronged approach, putting out the fire and preventing the buildup of uric acid in the first place.
Exactly.
Okay, so we've covered a lot of ground here, from medications that act on the nervous system to those that target the musculoskeletal system. But I think it's time to move on to another fascinating area of pharmacology: medications that target the skin.
The skin, our largest organ and our first line of defense against the outside world.
It is, and it's subject to a wide range of conditions, from acne to
Yeah.
infections to even burns.
Exactly. And that's why there's a whole category of medications designed to treat skin conditions.
So let's dive into some of those key drug classes. What's the first one that comes to mind?
Topical corticosteroids. We've already talked about corticosteroids in the context of treating inflammation in other parts of the body.
Right.
But they're also commonly used to treat skin conditions like eczema and psoriasis.
Eczema and psoriasis, those are both chronic inflammatory skin conditions
They are.
that can cause redness, itching, and scaling.
Exactly. And topical corticosteroids help to reduce that inflammation, relieving symptoms and improving the appearance of the skin.
So it's like calming down that immune response in the skin, giving it a chance to heal.
That's a good way to think about it. And then there are topical retinoids, which are derived from vitamin A and are often used to treat acne.
Acne, those pesky pimples, blackheads, and whiteheads
Exactly.
that plague so many of us, especially during adolescence.
Especially during adolescence, and topical retinoids work by unclogging pores and reducing inflammation, helping to clear up acne.
It's like giving the skin a deep clean,
Is.
removing those impurities that can lead to breakouts.
Exactly.
Okay, and then there are topical antibiotics,
Topical antibiotics.
which are used to treat bacterial infections of the skin.
Yes, bacterial skin infections can be caused by a variety of things, from cuts and scrapes to insect bites.
And topical antibiotics work by killing the bacteria that are causing the infection.
Exactly. It's like putting a stop to those microscopic invaders.
Yes.
Giving the skin a chance to heal.
And then there are antifungal medications,
Antifungal medications.
which are used to treat fungal infections of the skin.
Right, like athlete's foot and ringworm.
Fungal infections can be tricky to treat because they thrive in those warm, moist environments.
Exactly. That's why it's so important to keep the affected area clean and dry
Right.
and use those antifungal medications as directed.
And antifungal medications work by killing the fungi that are causing the infection.
Exactly. And then there are antiviral medications,
Antiviral medications.
which are used to treat viral infections of the skin,
Okay.
like cold sores and shingles.
Viral infections are often difficult to treat
They are.
because they replicate inside our cells,
They do.
making them harder to target.
Exactly. But antiviral medications work by interfering with that replication process,
Okay.
slowing down the spread of the virus and giving the immune system a chance to fight it off.
So it's like putting the brakes on the viral replication machine.
That's a great way to put it.
Okay. So we've covered medications that treat inflammation, acne, bacterial infections, fungal infections, and viral infections of the skin. But what about medications that target burns?
Burns, those are a serious type of injury
They are
that can damage the skin and underlying tissues.
incredibly painful and even life-threatening,
They can be.
depending on the severity.
Absolutely. And the treatment for burns really depends on the severity of the burn.
Okay.
But it often involves pain relief, wound care, and infection prevention.
So let's break down those different aspects of burn treatment.
Okay, so for pain relief, analgesics, both over-the-counter and prescription, can be used to manage the pain.
Pain management is so crucial
It is.
for burn patients.
It is. That pain can be excruciating.
Yeah, and then for wound care, dressings are used to protect the burn and promote healing.
Dressings can help keep the wound clean, prevent infection, and create a moist environment that promotes healing.
Okay, and then for infection prevention, topical antibiotics are often used.
Yes, to prevent bacterial infection.
Right, because bacterial infections are a common complication
They are.
of burns because the damaged skin provides an entry point for bacteria.
Exactly, and topical antibiotics help to kill those bacteria,
Right.
preventing infection and promoting healing.
It's amazing how these medications can help protect and heal that damaged skin.
It's a testament to the power of pharmacology to address such a wide range of health concerns.
Okay, so we've covered a lot of ground here,
Yeah.
from medications that act on the nervous system to those that target the skin. But I think it's time to move on to another fascinating area of pharmacology medications that target the eyes.
The eyes are windows to the world, allowing us to see and experience all that life has to offer.
And when things go wrong with the eyes,
Yes.
it can have such a profound impact on our quality of life.
I'm thinking glaucoma, cataracts, macular degeneration,
All of those.
all those conditions that can impair vision and even lead to blindness.
Exactly, and that's why there's a whole category of medications designed to treat eye conditions. So let's dive into some of those key drug classes. What's the first one that comes to mind?
Glaucoma medications.
Glaucoma medications.
Glaucoma is a condition that damages the optic nerve, which connects the eye to the brain.
Glaucoma is such a serious condition.
It is.
It's like a silent thief stealing your sight without you even realizing it's happening.
It's a great way to put it. Glaucoma often has no symptoms in the early stages,
Wow.
which is why regular eye exams are so important for early detection and treatment.
So what are some of medications that are used to treat glaucoma?
So there are several classes of medications that work in different ways to lower the pressure inside the eye,
Okay.
which is what damages the optic nerve.
So it's all about reducing that pressure
Exactly.
to protect that optic nerve.
Exactly. So some medications like prostaglandin analogs, they increase the outflow of fluid from the eye, while others like beta blockers reduce the production of fluid in the eye.
So it's like adjusting the faucets
Yeah,
to control the flow of fluid in the eye.
exactly. And then there are medications that treat cataracts.
Cataracts, those are cloudy areas that develop in the lens of the eye,
Yes.
making vision blurry or hazy.
Exactly. And cataracts are so common, especially as we age.
So how are cataracts treated?
The only effective treatment for cataracts is surgery, to remove that cloudy lens and replace it with an artificial lens.
It's amazing how eye surgery has advanced
It is.
over the years, making cataract surgery a relatively routine procedure.
It really is. And then there are medications that target macular degeneration.
Macular degeneration, that's a condition that damages the macula, the central part of the retina,
Yes.
responsible for sharp central vision.
Exactly. And it's a leading cause of vision loss in people over 50.
So are there medications that can reverse macular degeneration?
Unfortunately, there's no cure for macular degeneration,
Okay.
but there are medications that can slow its progression and preserve vision.
So again, it's all about early detection
It is.
and treatment to minimize the damage.
Exactly. So some medications, like anti-VEGF drugs, they block the growth of abnormal blood vessels in the eye, while others, like vitamins and antioxidants, may help to protect the macula from further damage.
It's amazing how those medications can target such specific processes in the eye.
It is a testament to our growing understanding of the eye and its intricate workings.
Okay, so we've covered a lot of ground here today, from medications that act on the nervous system to those that target the eyes. But I think it's time to shift gears a bit and talk about a topic that's near and dear to my heart: pharmacology and mental health. It's something that affects so many people, yet it's often shrouded in stigma and misunderstanding.
You're absolutely right. Mental health is just as important as physical health, and there's no shame in seeking help for mental health conditions.
And thankfully, there are medications that can help to manage conditions like depression, anxiety, and bipolar disorder,
Absolutely.
making a world of difference in people's lives.
They really do.
And these medications work by targeting different neurotransmitters in the brain,
They do.
helping to regulate mood and emotions.
Exactly. It's like fine-tuning that chemical symphony in the brain.
Yes,
Restoring harmony and balance.
that's a beautiful way to put it.
Thank you.
So let's dive into some of the key drug classes that are used to treat mental health conditions.
Okay, so one of the most well-known classes of antidepressants are the SSRIs, selective serotonin reuptake inhibitors.
SSRIs, those are the medications that are often prescribed for depression and anxiety.
Exactly. They work by increasing levels of serotonin in the brain, a neurotransmitter that plays a key role in regulating mood, sleep, and appetite.
So by boosting those serotonin levels, SSRIs can help to lift mood and reduce anxiety.
Exactly. And then there are SNRIs, serotonin norepinephrine reuptake inhibitors,
Okay.
which work similarly to SSRIs, but they also increase levels of norepinephrine,
Okay.
another neurotransmitter involved in mood regulation.
So SNRIs are like a double whammy,
Exactly.
targeting both serotonin and norepinephrine.
That's a good way to think about it. And then there are tricyclic antidepressants, or TCAs.
TCAs.
Yeah, which is an older class of antidepressants that work by affecting multiple neurotransmitters in the brain.
Right, and TCAs can be effective,
They can.
but they also tend to have more side effects.
More side effects than SSRIs or SNRIs. That's true.
And then there are MAOIs, monoamine oxidase inhibitors,
MAOIs.
which are another older class of antidepressants that work by inhibiting the enzyme monoamine oxidase,
Yes.
which breaks down neurotransmitters in the brain.
Exactly.
And MAOIs can be very effective for certain types of depression,
They can.
but they require a strict diet
They do.
and can interact with certain medications.
Yes.
So they're not typically a first-line treatment.
Right.
And then there are atypical antidepressants,
Atypical antidepressants.
which work in a variety of ways
They do.
and are often used when other antidepressants haven't been effective.
Exactly. So it's like having a toolbox
Right.
of different options to choose from depending on the individual's needs
Exactly.
and their situation.
And then there are mood stabilizers,
Mood stabilizer.
which are used to treat bipolar disorder.
Yes, a condition characterized by those extreme mood swings between mania and depression.
And bipolar disorder can be so challenging to manage.
It can.
But mood stabilizers can help to even out those mood swings, reducing the severity and frequency of both manic and depressive episodes.
Exactly. One of the most well-known mood stabilizers is lithium,
Lithium.
which has been used for decades to treat bipolar disorder.
And lithium can be very effective, but it also requires careful monitoring,
It does.
as it can have side effects.
Absolutely. And then there are anticonvulsants, which are also used as mood stabilizers,
Okay.
particularly for people who don't respond well to lithium or can't tolerate the side effects.
That's like having backup options
Exactly.
when the first-line treatment isn't a good fit.
Exactly. And then there are antipsychotics, which are used to treat psychotic disorders like schizophrenia,
Right?
but they're also sometimes used to treat bipolar disorder,
Okay.
particularly during those manic episodes.
And antipsychotics work by blocking dopamine receptors in the brain,
Right.
helping to reduce hallucinations, delusions,
Yes.
and other symptoms of psychosis.
Exactly. And, it's important to remember that medications are just one piece of the puzzle when it comes to treating mental health conditions.
Absolutely. Therapy, lifestyle changes, social support are all crucial components of a comprehensive treatment plan.
It's about addressing the whole person,
Yes.
not just their symptoms.
I love that. And speaking of addressing the whole person, I think it's important to acknowledge that medications can have both intended and unintended effects on the body.
You're absolutely right. No medication is without risk.
Right.
And it's important to be aware of those potential side effects before starting any new medication.
So let's talk about some of the common side effects
Okay.
that people might experience when taking medications.
Well, one of the most common side effects is gastrointestinal upset.
Okay.
Nausea, vomiting, diarrhea, constipation.
Those are never fun.
They can be very uncomfortable, and they're often caused by the medication irritating the lining of the stomach or intestines.
So what can people do to minimize those GI side effects?
Sometimes taking the medication with food can help,
Okay.
and if that doesn't work, there are over-the-counter medications that can help relieve symptoms like nausea and diarrhea.
Good to know. What about other common side effects?
Another one is drowsiness or fatigue.
Right. And that can be especially problematic if you're taking medication during the day,
It can.
when you need to be alert.
Exactly. And it's often caused by the medication affecting the central nervous system.
So if you're experiencing drowsiness or fatigue, it's important to talk to your doctor
It is.
because they may be able to adjust your dosage or switch you to a different medication.
Absolutely. And then there are allergic reactions, which can range from mild to severe.
Allergic reactions are always a concern
They are.
because they can be unpredictable and potentially life-threatening.
Exactly. It's important to be aware of those signs and symptoms of an allergic reaction.
Right.
Things like hives, itching, swelling, difficulty breathing, or a drop in blood pressure.
And if you experience any of the symptoms,
Yes.
it's crucial to seek medical attention immediately.
Absolutely. And another important consideration is the potential for drug interactions.
The regular act.
Yes, those are situations where one medication can affect the way another medication works.
And those can occur between prescription medications, over-the-counter medications, and even herbal supplements.
Absolutely. So it's really important to let your doctor or pharmacist know about all the medications and supplements you're taking, even if they seem harmless.
You're right. And another important aspect of pharmacology is understanding that concept of drug tolerance and dependence.
Drug tolerance and dependence.
So drug tolerance,
hmm
that's when the body becomes less responsive to a medication over time,
It's
requiring higher doses
Yes.
to achieve the same effect.
It can occur with many types of medications, particularly those that affect the central nervous system,
Right.
like pain relievers and anxiety medications.
So if you find that your medication isn't working as well as it used to,
Right.
it's important to talk to your doctor.
It is.
They may need to adjust your dosage or switch you to a different medication.
Exactly. And then there's drug dependence, which is when the body becomes physically or psychologically dependent on a medication.
And dependence can lead to withdrawal symptoms if the medication is abruptly stopped.
It can, and it's important to work with your doctor to gradually taper off any medication
Right.
that you've become dependent on
Right.
to minimize those withdrawal symptoms.
Okay, so we've covered a lot of ground here today, from the basics of pharmacology to the complexities of drug interactions, side effects, tolerance, and dependence. But I think it's important to end on a positive note by emphasizing the incredible power of medications to heal, prevent disease, and improve quality of life.
I agree. Pharmacology is a remarkable field, constantly evolving, discovering new ways to manipulate the body's systems for therapeutic benefit.
It really is a testament to human ingenuity and our relentless pursuit of better health and well-being.
And I think it's so important for everyone to be an informed and empowered patient.
Absolutely. Don't be afraid to ask questions. Do your research and advocate for your own health.
Talk to your healthcare providers, read reliable sources of information, and be an active participant in your healthcare decisions.
Knowledge is power, and understanding the medications that you're taking can make a world of difference.
It's been a pleasure sharing my knowledge of pharmacology with you today, and I hope you found this deep dive informative and engaging.
Thank you so much for joining us today, and to our listeners, thank you for tuning in to The Deep Dive. We hope you learned something new, and we encourage you to stay curious and keep exploring the fascinating world of pharmacology. Until next time, stay informed and stay healthy.